a marked decrease in thickness, affecting the anterior region of the mandible, which potentially leads to diagnostic issues. And/or in the surgical planning, follow this case. Guys, are you okay? Guys, I brought a case here today to present and discuss. The importance of tomography is in diagnosis and surgical planning. Okay? Here is a 51-year-old patient who has this injury that is not our target for today's discussion. This here is a cemento-osseo dysplasia, okay? It is not the object of discussion. But looking at the overview, we observe in this previous region a fair of very significant definition of the trabecular pattern. When we look at this pattern, it's the first idea that comes to our mind, right? These are technical factors, acquisition factors, which would be the overlap of the column, associated or not with these bone and dental structures outside the imaging layer of our equipment. Right? And these changes to these factors alone or in combination, leading to this loss of definition of our bone in the anterior region of the mandible. Okay? In some cases, it can even be confused with bone injuries. Now let's look at the CT scan of this patient and the importance of this case. If, for example, this region were a request for implant, for planning for implant in which the dentist is still, were to make the planning using only a panoramic view, we will understand the reason for this variation of the specific trabecular pattern of our patient. Opening here to take right. So we have the axial slices, the axial, coronal and sagittal slices. Look how interesting. When you pull down a little bit, you zoom in a little bit here in this previous region. Look how interesting. The moment we perform the axial cut and we observe the thickness in this anterior and worm region, it has practically or no trabecular bone. It is only cortical bone and therefore gives characteristic in the visualization of panoramic radiography. If we are going to evaluate the thickness here, then basically it is just cortical bone in this anterior region, if we are going to measure it. Reaching the measurement here of approximately 2 mm, right? In this anterior region then, returning to our panoramic radiography, we realize that this alteration of the trabecular pattern may also be associated with the overlap of the column that we observe here. It may also be associated with the issue of the image layer, but it has a main factor which is bone thickness. And if this factor is not considered at the time of surgical planning, thinking about an implant, this can lead to surgical complications, okay? So be careful. When we notice this change in the trabecular pattern in this anterior region, and we think exclusively about a technical problem or technical factors, that I may have something more associated with that tomography is very important for these cases. Okay? Wishing everyone a fantastic week.